We're going to talk about nerves today, and actually I've got Carol, my friend here, helping us. I think we might go next door where it's a little bit less loud so that you can hear me today. So if you follow me, we're going to go into another room. So, live videos, this is what happens in a live video. It's a bit noisy. Today I said we would talk about nerves. So in Pilates therapy, we have a module on nerves. Pilates doesn't generally teach nerves, so it's one of the things that when I started doing other bits of training, I realized were really important and that we were really missing in Pilates. So I have taped on myself the sciatic nerve, which I'm sure that you as teachers have all heard of, and it separates down the leg into what we call the tibial nerve and the peroneal nerve, and innervates different bits of our leg. We've got arm nerves that we're looking at today, and we have got the nerve in the middle, which is called your median nerve, and it's in the middle, so that's nice and easy. And it innervates the inside of your arm and into the palm of your hand, and the first three fingers and the inside of your fourth one. We've got a nerve on the top. It's called your radial nerve, and it's going to innervate the top of the hand into the fingers, and then your little finger coming up the side or the lateral part of the arm is your ulnar nerve. And I thought today, as we're Pilates teachers and we're moving people, we would have a little look at when we move the arm. You can see the effect it has. It starts to tension a nerve. So in different positions in whatever I'm doing, whether I'm holding onto a bar, I'm tensioning my radial nerve. If I'm working on equipment, if I'm doing arm openings, I will be tensioning my medial nerve. And if I start to take my arm over my head, you can see what happens to my ulnar nerve. So it's really important for us as Pilates teachers to understand what's going on with the nerves and the nervous system. We will teach more about how the nerves work and how it affects us. When we are looking at movements with our clients, and they start to do things like bending their elbows or feeling restrictions, sometimes these are not muscular, but they are coming from the nerves. So there are things that you can do to help out the nerves. And again, looking at the sciatic nerve, if I was to take a roll down, you can see what an enormous amount of tension I might create on that nerve. And also, depending on how my foot was sitting, I'll be affecting those nerves down there. So it is something that's really important for us to look at and know about. So what I thought I would do, because on all my live videos, I like to give you something that you can do yourself and try. So we're going to start with looking at your median nerve, which is this one, and how you can test it on your own body, and you can look at your clients. So I want you to stand, and I want you to pull your thumbs or your hands up. So you're reaching your palm into the ground, and you may or may not find that you feel tension up that chain. If you don't feel tension, then you can generally start to take your arm out to the side, and it's going to create tension. So these nerves all come all the way from the base of the skull, so we can use our head to tension it even more if it comes from there. So when you find a bit of tension, I want you to just have a go at shrugging your shoulder up. If that takes the tension away, you know it's your nerve. It's not muscular because we're working right from the top. So you might feel tension here, but when you lift your shoulder, it slackens the nerve off between here and here, and it takes that tension away. So if you find that you've got tension and the shoulder lifting it up takes that tension away, then I'm going to ask you just to shrug your shoulder up and down, and this is what we call a nerve glide. And we teach you different methods. So there are slides, there's types that you tension it, and there's types where you actually don't tension the nerve so much. There are different protocols for trying to free that nerve along the chain. So if you've been lifting your shoulder up and down, you should start to feel that that tension eases a little bit. And that would be called a nerve glide for the median nerve. So hopefully you've all tried that at home, and you found the bit of tension and you were able to release it, and you can now take that into your Pilates classes or into your therapy rooms, and you can start to release the median nerve. Anyway, it's Bonnie Southgate from Pilates Therapy. We have got modules on nerves coming up in Dorset. If you check out www.pilatestherapy, you can find our schedule of courses and our nerve day. Thanks very much.